Good afternoon. This is Debbie. Welcome to my very first BLS class. As a disclaimer or disclosure, this is going to be recorded for exam purposes. Of me. Um, First of all, I'll introduce myself. I'm Debbie, self-development coordinator. I think you guys all know me here. Some of you may not recognize each other, so if you go and do your introductions.
I'm Maria, LPN.
Carlos, LPN.
Anita, speech.
Brittany, LPN.
Okay, welcome. All right, so this is going to be an interactive course. You're going to have video training as well as practice while watching video, and then we'll do the skills portion of it, okay? So I'm going to go ahead and start the video.
Heart disease is the #1 cause of death in both men and women globally and claims more lives than all forms of cancer combined. Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately. Cardiac arrest does not discriminate. It can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, or CPR, are crucial for survival from cardiac arrest. Healthcare providers are the backbone of the systems of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support, or BLS. This training will guide you through the key practices of high-quality BLS.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment such as gloves. The AHA's mission of saving lives is a global initiative. The AHA recognizes that heart disease is the #1 killer of both women and men. However, most skills in this video will be demonstrated on male victims to respect global awareness and cultural sensitivity. On any given day, and at any time, you could encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you receive today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There's more information on the differences between heart attack and cardiac arrest in your provider manual.
First, let's talk about the 2 adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. Both chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the in-hospital chain, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment, and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate. For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions.
Because most adult cardiac arrests occur at home or in other places that are outside of a hospital, we'll look at the chain of survival for an out-of-hospital cardiac arrest first. A son drives his father to a doctor's appointment. The father collapses, and his son realizes that he needs to find help. A nurse runs out of the doctor's office and tries to get a response from the father. She recognizes possible cardiac arrest and sends the son into the office to call for help and set the emergency response system in motion.
The chain of survival begins right here with the nurse's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must first recognize the signs of cardiac arrest, such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should immediately activate the emergency response system and begin high-quality CPR.
Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are two simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The nurse begins chest compressions without delay. The office assistant summons another nurse to help. The second nurse arrives with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight, portable device that can identify an abnormal heart rhythm that needs a shock. The AED could then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
Once EMS providers arrive and take over, they provide advanced life support. This extends the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the person.
After the person achieves return of spontaneous circulation, or ROSC, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
There are several steps of BLS that need to be performed when you suspect someone is in cardiac arrest. First, assess the scene quickly to make sure it's safe for you and the victim. Then, simultaneously check for breathing and a pulse.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or a pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and a framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
Now we will focus on the individual skills that rescuers perform. it is most effective to perform CPR as a team. But to be an effective team member, you'll need the individual skills of CPR. So, we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on a firm, flat surface. If you need to remove clothing to expose the person's chest, do it quickly. You need to work with a bare chest because later you'll attach the AED pads to bare skin.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of a cardiac arrest, there's still oxygen in the bloodstream. Starting CPR with chest compressions can pump that oxygenated blood to the brain and heart. After you give compressions, open the person's airway and deliver breaths. It's important to minimize interruptions in chest compressions to 10 seconds or less. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. When you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast. There is some evidence that compressing too deep can increase injuries from CPR. However, a larger problem is that most providers don't compress deep enough. So focus on making sure your compressions are deep enough. Compress at a rate between 100 to 120 per minute while counting out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil after each compression. We recommend using a feedback device that provides real-time corrective feedback on CPR quality regarding rate, depth, and chest recoil, not just when performing CPR in practice, but also in your workplace. We'll talk more about feedback devices throughout the course, and you will complete some practice and testing with them later.
You can follow along with what's on the screen as you perform compressions yourself. You'll perform 3 sets of 30 compressions after you assess the scene. We'll pause here while everyone gets into position.
Okay. I have an example of an AED here, but we don't use it in this, in Southern. So we're not going to focus on this portion of it. We're just going to focus on compressions. I do have a feedback device that we'll use for each. Okay, so you guys can get into position 2 and 2. And then
I'll jump on over.
and then let me know when you guys are ready. So one person is gonna do compressions first, and then we'll switch, and then the other person will practice compressions. We're not doing this yet, this piece yet. So whoever's, and then this will tell you, it'll be, if it lights up green, it's telling you that your compressions are good.
Oh, that is so cool. All right.
Alright, so, are you guys ready?
Mm-hmm.
Alright. Remember, you're doing
Okay.
follow along
Let's
with
begin.
it. No, wait.
3, 2, 1.
Hold on. Okay, stop. Follow the
Oh.
Are you okay?
so he's doing his, just follow what he's doing. So you remember, you're gonna assess the scene by, look at the scene, find out if the patient needs CPR or not, and then proceed. Okay, so let's start. It's working.
My God, doesn't anyway.
Technical difficulties. Okay, we'll do,
There are several steps of BL.
okay.
Now we will focus on the individual skills that would start.
Before you start chest compressions, make sure the person is lying.
Okay, are we ready? So just to follow along with the video.
Let's begin. In 3, 2, 1.
That's the scene.
Hey, are you okay? Are you okay?
You okay?
Someone help.
Okay.
No pulse. No chest.
Activate the emergency response and get an AED.
And you're gonna do it for 5 to 10 seconds. And you do this.
1, 2, 3, 4, 5, 6, 7, 8.
Count, counting, so.
5,
We'll switch. We will switch. So just increase your speed and just count with them. Okay, that's okay. Go ahead. Yeah.
Here, I'll just turn it towards you, sorry.
No, well, stop. I'm just, when I say,
Oh, you meant switch, but not
yeah,
start
yeah,
yet.
okay, so just, okay.
Okay.
Go ahead and, okay, so we'll start. Go ahead, Anita, and,
Okay.
okay, go ahead.
Oh, you're gonna assess your person.
Just, we'll do it again.
Okay.
Same person or?
No, you're not. This one pause. Okay, Anita and, Brittany, go ahead and let's do it one more time. I'm sorry, okay, so ready?
Begin. Let's begin. Okay. Let's begin. In 3,
2,
2, 1.
what's wrong with my thing? Oh, here we go, okay.
Hey, are you okay? Are you okay?
Okay, he's not okay.
Someone help. Activate the emergency response and get an AED.
And you say, call the code blue, right?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, do it one more time, we'll just, we'll do it again.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 6, 7, 8, 9, 30.
I would count with it,
1, 2,
okay?
3,
Are you doing it again?
No, you can take a little pause.
Yeah.
Then
These things are hard.
then we will switch. Well, you know, think about your.
Yeah, no, I know.
8, 29, 30.
Okay, so you guys can switch, you'll move the, or however you wanna do it. Move this up.
Yeah.
We're good at slipping across.
Alright, so we'll play it again. You guys ready in position? Okay.
It's high too.
I know it, yeah.
So now, let's go through the use of pocket masks. And then
Careful, Tom.
we'll practice one rescuer skill for
Technical
concussions
difficulties,
and
I'm sorry,
burns.
Pete, I'm sorry, guys,
It's alright. I'm excited over this thing.
I'm not doing pocket mask.
Get ready. Begin.
Okay. Lessons, one rescue.
There are several steps of BLS that need to. Now we will focus on the individual skills that
Before you start chest compressions, make sure the person is lying face up.
Okay.
Okay, let's begin. In 3, 2, 1.
Hey, are you okay? Are you okay? Help, someone help.
Okay.
Activate the emergency response and get me.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12,
No, that's the short, yes, sir.
I'm on my tippy toes.
21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now, they would be in a bed so we could lower it.
It'd
more.
be easier than not trying to do it on the table.
I know, I'm on my tippy
Yeah.
toes.
5, 6, 7, 8,
Okay.
9, 10,
We'll stop
11,
right there.
12, 13, 14, 15, 16,
You guys
17,
feel like you
18,
need more
19,
practice
20.
for the depth? I know Carla and Anita, we need to work on, I'm not calling you guys out, but you know,
No,
just,
but yeah.
okay? So what we're gonna look at next is
Yeah,
the
you
bag.
can do
We're gonna be
break
looking
the
at the
roots for
bag
sure.
mask, we're gonna be looking at this next, and it's just the bag, so we of course don't do, you know, we don't do mouth to mouth. You guys can have a seat.
My water's,
Oh, here's your water.
Especially in respiratory-related emergencies such as drowning, anaphylaxis, and asthma. Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because using a bag mask device is such an important skill and is common in the healthcare setting, we'll work on it now. Bag mask devices consist of a ventilation bag and a face mask, and they come in a variety of sizes. You can also use supplemental oxygen with a bag mask device.
To begin, position yourself directly above the person's head. You'll use the EC clamp technique to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow end of the mask onto the bridge of the person's nose. Then lower the mask fully onto the face, watching for the cushion to bulge as it initially seals against the face. Form a C with the thumb and index finger of one hand and press down on the dome of the mask toward the face to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back, lift the jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, you're not providing adequate breaths. If you don't get chest rise, readjust the mask, reposition the head and neck, and try again to ventilate. And then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, The most effective way to deliver breaths with a bag mask device is to use the two-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face, and the 3 remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the one rescuer bag mask technique, so that in a few minutes, we can combine it with compressions to work on a two.
Okay, so you guys can get in position again, and then just follow along with the video, okay? So, let me know when you're ready. Okay.
Now that we're ready, let's practice using the bag mask device. Follow along with the video. Here we go in 3, 2, 1. Give 2 breaths. Watch for chest rise. Give 2 breaths.
A difference between.
You're supposed to rise, right?
Will these rise too?
Give 2 breaths.
As long as you're doing the technique right, you form
Yeah.
3 fingers, 2 fingers, and then one, and then.
Give 2 breaths.
Don't worry about the rise right now, Carter, just worry about the positioning of your
Yeah.
hand. So remember what to do the C.
And give 2 breaths.
Right, and then the E. This is your E, this is your C, then you're gonna shake and squeeze. Greater than 1 second.
Yeah.
Alright, so just go ahead and do it again and do it, we'll repeat. And then just make sure you have your hands and positioned in
Now that we're ready,
the
let's
EC.
practice using the bag mask device. Follow along with the video. Here we go in 3, 2, 1. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths. Give 2 breaths.
There's a grip right under there.
And give 2 breaths.
When you're
Yeah, I like the 2 person.
Better.
That's better, 'cause
And you're in a setting where you
Yeah,
get 2
I
person,
find
just
how
remember the
it's
C.
like,
and then
Cause that's
E,
the problem,
and then
your
tilt.
little hand.
And then you give your breath. Yeah, so, okay, so switch.
Now that we're ready, let's
Mhm.
practice using
The
the
one
bag mask
hand.
device. Follow along with the video. Here we go in 3, 2, 1. Give 2 breaths. Watch for chest rise.
Tilt. No, okay, you have it tilted, okay.
Give 2 breaths.
That's good, as long as I'll get the machine working.
Give 2 breaths. Give 2 breaths. And give 2 breaths.
Okay, you guys have the hand placement right. Okay, so we'll
The
practice
C
with,
and the E.
yeah, the C and the E.
I
Yeah,
would've been doing the same thing you were doing, but you told me about
Yeah.
that.
That helps.
So thanks for.
So I mean, you guys, so now we're gonna look at, the two-person BLS, which is what we essentially do in our setting, we do two people or more. You guys can have a seat.
Cardiac arrest takes place close to where emergency medical services might be. And even then, immediate CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater the chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
For many healthcare providers and other rescuers, the two-person or team rescue is a more common occurrence. So let's first look at the roles for two-person rescues. The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. Basically, they're handling the situation at first as a one rescuer scenario. And the second rescuer is responsible for powering up the AED and attaching the pads when a device becomes available, as well as for providing ventilation.
The compressor should pause when ventilations are being given until an advanced airway is secured. The compressor may also need to briefly pause when the advanced airway is inserted. And if you're performing CPR without an AED, you should switch roles when fatigued or after every 5 cycles. That's about every 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze, or sooner if the compressor is fatigued. This switch should take less than 5 seconds to minimize interruptions in chest compressions. We'll learn more about how to effectively switch roles in the team dynamics section.
In two-rescuer CPR, each rescuer has a specific role. Rescuer number 1 should be positioned at the person's side, ready to perform chest compressions and count them out loud. And rescuer number 2 should be positioned at the person's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for the chest to rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
Now let's practice two-rescuer BLS. Follow the video as you practice.
Okay,
We'll work on the full sequence, from the point of finding the victim until advanced medical help.
so let me know when you guys are ready, just get in place, in position. You ready?
Yeah.
This is practice while watching, so you watch and you practice, you know, so.
Yeah, count on that.
Alrighty? I'm gonna go ahead and play.
Okay, let's begin. In 3, 2, 1.
Remember it's your victim, first you have the victim and then you have to perform.
Hey,
so-
are you okay? Are you okay?
It's not okay.
Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Well, so this is supposed to be really fast, remember?
Wow, yeah.
It's supposed to be like 1 second, yeah.
23, 24,
So-
26, 27, 28.
So you can have it on his nose while
Oh,
you're
and then,
pressing.
yeah.
Yeah, so already have it ready on his nose, do your compression.
So don't remove it, just.
Mhm.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22.
Then you give your.
And then when she gets to learn
So
the
we'll
other
do this, so just rest your little elbows, Carla.
Yeah,
Switch and then we'll do it again, yeah. And then remember to lock your, your
Sorry.
elbows have to be
Here, go
locked,
ahead.
okay? I know it's,
Yeah.
your elbows should be locked in place, not like this. Straight. Okay, so, and then guys, you have to
Okay,
follow through, so
let's
you're
begin.
walking in
On
on the
3,
scene.
2, 1.
So you don't have a bag.
Hey, I go.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED.
So we say code blue.
Code blue.
There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
God, you're all
17,
great.
18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Until, and then do it
1,
slowly, not.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22.
No, so you guys know it's 30 to 2, and you have to give the breaths like over 1 second, not
Not fast.
not too fast, right? So you do it, and then it's a 5 cycles, so that's every 2 minutes, and that's what we wanna do, as, you know, until the 911 shows up and they go out, or they recover. Okay, so we'll switch. Again, switch again, so we'll practice again.
I gotta do something.
Get your, do you wanna bring it lower, Carla?
Yep. No, I'm good now.
No, she's short. Next time I'll have a stool for you. And Brittany, but Brittany's pretty.
Just got up on my
Okay, ready? Let me go ahead. And remember, you're assessing the scene first before you
Okay.
start.
Let's begin. In 3, 2, 1.
Okay. Hello?
Hey, are you okay? Are you okay? Activate the emergency response and get an AED.
Okay, no falls. Code blue.
There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And then you would say switch and you might be up, right? And then somebody else would.
1, 2, 3, 4, 5, 6,
Go
7,
ahead. You
8,
guys can,
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22.
Okay, so now we'll switch one more time so that you guys have a second chance at it. And then, like I said, in real life, what are we gonna say? We're gonna ask to switch, right? So somebody else can take over. You don't have to do the full 5 cycles. Tell me when you guys are ready.
Ready?
Alright, so can you go ahead and start?
Okay, let's begin. In 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED.
You have to do your assessment. You did your
There's
assessment.
no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You have to lift the pressure. Speed it up.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, so when you got the depth.
Yeah.
So now we just have to, we're
1,
good
2,
job.
3, 4,
Good.
5, 6,
Good.
7, 8, 9, 10,
You'll be doing it
11,
on us.
14,
But I mean, you know, in
16,
real life, we're gonna keep
17,
going, right? But like I said, it will be
21,
multiple people, so we could, utilize each other. Okay, you guys can
Do
have a
like somebody
seat.
call 911.
Okay, we're gonna watch one more part, it's gonna be choking, and then we're gonna actually do the actual skills test, okay? So we're gonna watch a piece on choking, or obstruction. Menu.
When food or other items block a person's airway, choking occurs. In a severe airway obstruction, the person usually has signs of poor air exchange and breathing difficulty, such as a silent cough, an inability to speak or breathe, or cyanosis, that is, turning blue. Adults or older children who are choking may clutch their neck with both hands, making the universal choking sign. If someone indicates that they are choking and cannot talk, you must.
To perform an abdominal thrust, stand or kneel behind the person and place your arms around the waist. With one hand, locate the navel. Then make a fist with your other hand and place the thumb side of your fist against the person's abdomen, just above the navel and below the breastbone. Grasp your fist with the other hand and press your fist into the abdomen with a quick, forceful upward thrust. Repeat thrust until the object is expelled from the airway or the person becomes unresponsive.
If you can't wrap your arms around the waist because the person is pregnant or overweight, or simply can't stand, wrap your arms around their.
If you're not able to relieve choking in an adult or child, or if the person becomes unresponsive, have someone activate the emergency response system. Then lower the person to the ground and begin CPR.
Perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it. But do not perform a blind finger sweep because
Choking is also a fairly common emergency in infants. The steps to relieve choking: if you find an infant who is choking but is still responsive, first sit or kneel with the infant in your lap. Hold the infant face down and resting on your forearm with the head slightly lowered.
now that you're.
Okay, so let's just go over some for CPR. What's the compression rate to breath sounds?
32.
Okay, and what's your depth when you're doing your compressions? What's your depth? Approximately 2 inches, right, or 1/3 of the width of the chest. Let me see. How many breaths will you give? 2. Okay, we just asked that. Okay. Let me see what else we have. And if they're choking and they become unresponsive, what are we gonna do?
I look for the item in the
If,
airway.
if they're choking and you've done your Heimlich, not Heimlich, no, the abdominal thrust, what are we gonna do? If they become unresponsive? CPR, right, yeah. Mhm. Okay, alright, so, I'm gonna do the skills check, we're gonna work in teams again, and but I'm assessing each person individually for that, okay, so just, watch your depth, your compression depth, and the rate. So you should be doing it like at least 30 compressions within like 12 to 18 seconds, okay, so it has to be fast, deep and fast, okay? So I'm gonna give you a little scenario. The scenario is this: you're working in a hospital, clinic, nursing home, and you see a person who has suddenly collapsed in the hallway. You check the scene, you check the scene as safe, then you approach the patient and demonstrate what you would do next, okay? So you're gonna go through the whole scenario. So the person's on the floor, unresponsive, what are you gonna do, okay? That's your scenario. I'm gonna check your compression impression, we'll start with you guys first, okay?
Are we doing this as a team?
Yes, you can work as a team. You're in a,
Do you have to press?
you're in a hospital. Well,
We gotta do both,
both,
Oh, we're
so,
doing both,
yeah,
yeah,
okay.
so,
We'll switch after two.
We can just find our person on the floor.
yes, you found your person on the floor. What are you gonna do?
Hello, can you hear me? He can't hear us.
Then we
We're gonna check. There's no chest rise,
Call
he's not
code
breathing,
blue.
code blue.
Okay, call code blue, then what are you gonna do? You're gonna get your,
We're gonna get our equipment and get it ready and then start.
and that's all done within how many seconds?
Is it
It should be less than 10
5 to
seconds.
10?
10 seconds, right,
between
correct.
5 and 10?
Yes, 5 to 10.
More than, at least 5, but less than 10.
10, yes, mm-hmm.
Ready?
Okay. Okay, again, and then.
You got it once. I don't get it once. 1, 2, 3, 4, 5, 6, 7, 8, 9,
Okay, and then when you switch, what
Switch!
you're gonna do, you're gonna assess, remember, don't forget you have to assess yourself to check for breathing and you have to check for a pulse. Okay, we'll pretend that you've done your 5 cycles, but you have to check for your breathing and your,
Okay, so we just
So we
continue
show
yes,
it.
go ahead.
We
Oh,
just
okay.
continue.
Okay, continue.
Ready?
I think I went to the gym today.
I know, it's like.
I think you did better when you were actually standing with your.
Yeah, I did it
better.
that way, that's for sure.
Yeah. So again, with the same
I mean,
scenario,
I
remember,
sleep in
remember
bed
you'll
today,
have your,
too.
you're walking down the
Bed, jump right
hallway,
on the bed.
and you see someone on, you know, you're walking down the hallway, you have somebody, one of the residents collapsed, so then what are you gonna do? You check your seat for safety, so what are you gonna do next?
Come here, Bucky. In your dark, big dark. Okay, you're not talking.
So you're gonna, yeah. But in the meantime, you're also gonna call for help, don't forget.
Your cough up was,
Yeah.
you know how, you know, people on air, they have that red thing, when you do something, you know, you're supposed to go through.
1, 2, 3, 4, deep, 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 9, deeper. You did 30, okay. Then we'll do it one more time, Tara, and then we'll switch, but make sure you watch your
Yeah,
depth, okay?
it's not doing.
I know it's not down.
What shift do you usually work?
I'm actually free from 11 to 7, which is 11 to 7, and my son is going to be 11. But now I just go all the way, you will see me every shift. Which shift are you working?
And then we'll switch.
You were there about today, right?
So, same thing,
Where's the Debbie?
the scenario already occurred.
Yeah, that's.
So remember, if you were switching, right, this would still be on and you do a nice clean switch, right? So that, and let's see. Okay, alright, so you guys can have a seat, please, and I would just say, good job. And, I wanna just thank you guys for participating in this for me as well as for you guys. And then as soon as, I'll need signatures from you guys on a sheet that you participated. And then, we'll get your CPR cards, okay? I'm not sure when, but I will, get back to you with those.
I'm sorry, I don't.
Yes, I do. Do you have any questions? Concerns?
Well, we're gonna do question, right?
Mm-hmm.
When we're switching to that, when we're switching from that back to the compression, should we keep that next up or? Cause usually I put it
You
down.
can bring it down and then
Yes.
up again. So
Okay,
that
cause
the-
I bring it
yes,
down.
mhm,
Okay.
yeah. Any other questions?